Okay, so I'm back. So I am in week 6 of my foot, and I think I mentioned it in my previous post, but I had a slap tear in my shoulder that I went and had surgically repaired. So I am in week 4 of that rehabilitation process. So I'm gonna update you guys on everything that's happened over the past 3 weeks with my foot and my shoulder. Okay. So I had been typing the blog because, it's coronavirus time right now. So we've been in quarantine. So I wasn't able to get my hair cut, my eyebrows done, my waxes, nothing. So, yeah, I was not going to do a vlog with me looking like that. So now that I'm able to get my grooming done, now I can be back on a vlog with you guys. Week 3 was when I had the shoulder surgery. So let me tell you about this place. The surgeon was through Ortho Virginia, but the surgery center was Advanced Surgical Center Bethesda in Maryland. They called me and told me I needed to get a coronavirus test done the Friday prior to my surgery, which was on Thursday. Got the coronavirus test done, and they told me that they needed to have the test back by noon the day before the surgery. So that would have been noon on Wednesday. So Tuesday, I realized, I'm like, I haven't heard anything back about that test. And they told me that they would give me a call if it was positive. They would text me if it was negative. Didn't get text, email, anything. So Wednesday, I call up to the lab and I'm trying to figure out what's going on. They're like, oh, we haven't gotten your results back yet. Let me check and see. We'll give you a call back. Get a call from Ortho Virginia. They need the information of the lab because they haven't heard anything. Get a call from the surgery center. They're trying to get the information from the lab because they haven't heard anything. So pretty much I'm on a call back and forth all day with these two. And pretty much by 4 p.m., the surgical center says, we're going to have to cancel your surgery tomorrow because we haven't gotten your results. And I pretty much cussed this lady out. And I'm like, absolutely not. You told me to go to get a coronavirus test done on Friday because it had to be within 5 days of the surgical procedure. With how many people are trying to get coronavirus tests right now, the lab could be backed up. That's out of my control. You told me to get it done on Friday. I go and get it done on Friday. And because you don't have it by Wednesday, you're going to cancel my appointment. That's out of my control. That's an issue with the lab. So I feel like this should have been overridden. And I'm like, by this time the lab is like, oh, we can get it to you the next, Thursday morning. And I'm like, well, it's by the morning, they would have still been able to verify that I was negative. Furthermore, on Friday, it's still possible that I could have contracted the virus between Friday and the following Thursday. So it's not even that accurate. It just shows that as of last Friday, I didn't have it. But who knows what I did in that week leading up to, the shoulder procedure. So that was a disaster. Anyway, after badgering the lab so much, they ended up being like, yeah, we got your results. They're negative. We'll fax it over. So I get there and, usual COVID screen test, blah, blah, going through everything. And the lady had called and told me the total amount that I was supposed to pay for the procedure, but she at no point said, let's set up a payment plan or this is due at the time of the surgery. So the lady is like, oh, your total is going to be $1,014. How do you want to pay for that? And I'm like, what do you mean? How do I want to pay for that? I was not informed that I was going to be paying for that. So I'm not paying for that. Y'all can bill me. You can bill my insurance because I guarantee you I'm not going to pay $1,000 of my insurance. I'm not. So this place was real messy. I didn't like the coronavirus thing. And then I didn't like the fact that the lady was like, oh, you need to pay $1,000. And I'm like, no, nobody discussed this with me. So I'm not paying anything today. Y'all are going to do the surgery and then you can bill me. That's what's going to happen. And because it was on my right arm, they were doing the IV through my left arm. For whatever reason, they don't do the IV right here. They do it in the they do it in the hand for some reason. I'm not 100% sure why. I was kind of more focused on the fact that they stuck me 3 times before they could actually get a good vein. So I didn't even have a moment to ask why couldn't they do it here, because I was just like, please get this vein, please get this needle into my skin. Usually these are my right side. I understand I'm having surgery on that side, so that makes no sense to use that. But I'm very vascular, so I'm like, what do you mean you can't, find a vein? They stuck me all throughout my hand. Okay, they ended up being able to get this little vein all the way here by my pinky. It was really painful. I was so ready for the IV to come out, but they did it in up until the very moment that I was discharged when my ride was able to get there. So I was not very happy with the nursing staff there. Very friendly, but I need you to know how to stab a vein. In someone like me, how can you not find a vein to stab? The anesthesiologist was very good. She explained everything really thorough. They did a nerve block up here. Some IV to help me relax. I was feeling a little bit woozy as they carted me off to the OR. And then once I got in the OR and they put the mask thing on me and all that, took a couple breaths, knocked out, woke up and I felt pretty after the anesthesia wore off. I remember everything the doctor said to me. I remember him showing me the pictures. So pretty much what happened was I had a slap tear. And when they went in there, they also found a slight rotator cuff tear that he said he just put a stitch in, which seems like something very minor. And then I also had a bone spur, which he said is just, it was just my bone makeup. It wasn't anything that I did to cause the bone spur. It just happens sometimes. So he said it was just kind of like a piece of bone that was extended out further than what it should have been. And then that closed off the space between the bone and like the muscle. So that was causing like some of the pinching. So he shaved that down, which gave me more room there. So I have 3 incisions, one here, one on each part of the deltoid. This is the last steri strip. It's still hanging on for dear life, but they told me not to pull it off, so I'm not going to pull it off. But the other 2 have come off, and the nerve block, you know, makes it numb. So it was the craziest feeling because I couldn't feel my arm at all. Like it felt like my arm was foreign to me. So I touched it with my left hand. It felt like someone else's arm. I got home, and when I took the sling off, like my arm just bloop, just fell. Like I couldn't control it at all. So I learned from the foot that once the tingling started to happen, and I mean the anesthesiologist again explained this better than the foot guy did, but once I started feeling the tingling and I started to get movement on my fingers, then the nerve block was gonna wear off. But when that nerve block wore off, I don't remember like any significant pain with that. The issue that I had and I'm still having is with sleeping. I've been using a pillow, but I usually lay on my right side, so that's probably the biggest issue that I'm having, is that my body wants to rotate onto that side, and when I fall asleep in a different position, then kind of roll over in my sleep, then obviously I feel pain, and then I have to turn over, and then now I'm awake, and I have to figure out how to readjust. So that's kind of been an ongoing issue since I've had the surgery. It's gotten somewhat better, but still I usually have to take a pillow, and if I'm laying on my back, prop it up here, or if I'm laying on my side, my left side, put it there and then kind of hold on to it. It's kind of weird. So I feel like I was pretty coherent over the weekend. And so I used that time over the weekend to research physical therapy clinic. I'm researching sports physical therapists, specifically because the toe, I'm not really worried about that. I feel like anybody can work with a toe, but a shoulder, weightlifting, and gymnastics, you really want to go to somebody who understands what you're trying to get back to and how beneficial blood flow resistance could be. Where they put the cuff around your arm, it includes a certain portion, usually 50%, and you do certain exercises with it. It helps maintain the muscle mass and get more blood flow to the injured area, which helps expedite recovery. A lot of other, then I start researching blood flow resistance and ended up calling MMA and Sports Rehab, the guy who owns it. He has his DPT, his PT license, and he also has an SCS, which is a sports certified specialist. So he's better able to work with sports injuries. So that was one certification that I didn't see from anyone else that I looked at throughout the other clinics. And I looked through the staff's bios to see like what are their personal interests, what type of patients are they used to working with. That's going to dictate how you treat people. If you usually work with stroke patients, you're not going to be beneficial for me. I want someone who at least works with athletes, works with sports. I ended up being able to get an appointment the following day. I asked him a lot of questions, kind of really gauge his knowledge on how he would treat my rehabilitation situation versus someone else's. I told him like, here are the movements that I do. I want to be able to get back to this, whatever time span is. I just know that that's where I want to get back to. And he was really good. He had a timeline for everything. And he was very clear about pull-ups, snatches, pressing overhead, handstand, all that type of stuff is going to be the very last thing that you'll do. It wasn't false hope of, yeah, we can get you in this, or we can get you in that, or what. I liked he had explanations. Like, it was like he had done this before and he understood what I was trying to get back to. So I liked the conversation I was able to have with him. I definitely did want to make sure I was following his directions to the T. But being a strength coach, I'm always going to feel like there's something that I can be doing more. So everything, when I go to physical therapy, I'm always going to supplement my physical therapy with something else. Like, I'm still going to do my own personal workouts. There's research that shows even if I can't train this side, I can't do push-ups, presses, pulls with this side. If I do it with this side, there's going to be crossover, so I'm still could get some muscle growth and muscle stimulation from training this side. So pretty much week 3, once after my head surgery, I had a boot on and I had my arm in a sling and I had the adductor pillow. I looked like I just walked out of the ICU. Was I still doing my workouts? Absolutely. The physical therapist had me doing quarter squats with 10-second isometric holds in the boot because I couldn't go full range of motion because the boot locks my ankle at 90. But I like that because the same thing I would do with my athletes. You're in a boot, you can probably still do some sort of quarter squats. You know, we don't need to say don't squat at all, because then you're gonna have atrophy of the quad, the hamstring. You already got atrophy of the calf, and everything's getting stiff down there. But if we can still get you in a squat pattern, that's gonna help you when you get out of the boot, so that you can, you know, do normal squats. So after the first visit, he had me doing very basic stuff. He wanted me to wear the sling more. Now, the surgeon told me I didn't need to wear the sling like all the time. He was like, you know, don't get locked in here, because he was like, your range of motion is going to be harder to get the more you get locked in. And he was like, take it off, let your arm kind of move around and breathe within a pain-free range. So I'm like, cool, great. I'm teleworking. I'm sitting on my laptop all day. I'm sitting on the couch. I'm like, I don't need the sling on. But one thing the physical therapist told me that was like really eye-opening for me, he was like, think of the sling as like a safety net. So sitting at your desk and something falls off, your phone, whatever. If you don't have the sling on, especially as you're getting used to your shoulder being like out of commission, you're gonna reach for it with the injured arm, and that's gonna hurt. Whereas if you have the sling on, you may try to reach for it, but you're not gonna be able to get anywhere. When he said like that, I was like, that makes sense. You know, I never thought of it as like a safety precaution. I just thought of it as they want me in this position to help it heal. I did try to start wearing that more. I would wear it for my workouts. I'd wear it when I walk my dog, just so that, you know, he couldn't pull my arm if I was holding the leash with that arm. So my workouts, really supplemental stuff, really just watered down crap. I really not having a good time those 2 weeks. Everything is passive range of motion. He didn't want me moving my arm, so he had me get some pulleys attached to the back of the door, and he had me doing my passive range of motion with that. So with that, I was really, first couple of days, I could really just get the arm to about in front of my face. Now I can get it almost all the way overhead. So, I mean, just that progress that's happened in 3-4 weeks has been really big. He has me doing a lot of scapular work. He has me doing isometric holds against the wall for flexion, extension, internal, external rotation. Now that I'm in the active range of motion phase now, he has me doing active flexion. I like where physical therapy is at right now. I like where it's going. I do, and they have me doing the blood flow resistance every day. So it's just body weight curls, body elbow extension. Now I'm on the crossover symmetry bands. He has me doing extension, adduction, doing like isometric step out. So hold in external when you step in and out for, you know, a minute, 2 minutes, switch to the other side. So, I mean, I like what we're doing. But of course, I'm always, as the shoulder is feeling better and I can do more things. I was in the shower earlier and I realized that I can get all the way across here. So like, it was difficult for me to get here. And then all of a sudden I'm washing, and then I'm just like, and then I'm like, wait a minute, this is a range of motion I haven't been able to get before. So like, when you see that every day, it really just makes you really want to do all the stupid, slow, dumb shit that they have you doing at home. Now he has me working on internal rotation with the pulleys, which is it's really challenging. But even from the, I guess, 4 days I've been doing it, I'm still noticing that range of motion is getting more. As far as for the foot, the boot is off. Got the boot off on Wednesday. Everything looks good with the foot. Swelling has went down. It's still somewhat swollen. And then by the end of the day, it's swollen, but it's not like puffy, big balloon swollen. It's just like, it just kind of looks a little bit more swollen. So that's been good. So my walking has been good. I haven't been limping around or anything like that. As soon as I went to the doctor, I pretty much told him as soon as he walked in, like, I want this boot off. And he laughed and he was like, all right, well, let's take a look at your x-rays and let's see how your foot's looking. And I'm like, dude, if you don't get this boot off, I'm gonna be pissed, because I'm just so over the boot. It was uncomfortable. Like, it was just, it's hot, it's middle of summer. I mean, you know, I had the boot on my birthday. I had to take the boot off and put on a normal shoe for my birthday photo shoot. It's been good to be able to get on a bike, to be able to squat. The issues that I'm having with squatting, I'm getting pinching in the front of the ankle. Pretty sure that's just due to not having the range of motion to load up that dorsiflexion. So I've been working on that with my ankle mobility and trying to get that better. But that's been frustrating, but it's only been, I guess, 2 days of me doing that. So all in all, at this phase, I'm feeling pretty good about having the surgeries done. There were definitely some days where I thought I had lost my mind by having these surgeries. But honestly, like, with my line of work, this period of time of teleworking for 4 months really has allowed me to focus on like my recovery, and I'm glad that I got diagnosed when I did, and I'm glad I was able to have the surgery when I did, because even though, you know, I could have been outside running, doing my normal workouts, and you know, probably been in even better shape than I was before, because I probably had more time to allot to working out. This phase allowed me to take care of my body and get to a state where I was pain free and healthy. So I just try to keep reminding myself of that. Like by the time, you know, September comes, you know, next year around this time, like I'm gonna be feeling good. These things are gonna be healed up, and I'll be able to run pain free, lunge pain free, jump, do everything overhead that I want to do. It's just taking time right now to modify everything. And so that's been tricky for me. I haven't had to modify any of my workouts since I broke my leg. That was not the best time because I was in the middle of grad school. You know, having to juggle all that and then realizing that I don't have to juggle as much right now. I'm able to go to physical therapy for an hour and come home and do an hour workout, just sit down and recover. I mean, the amount of time I would have had to be on my feet and move around in the sling with my job, it would have been stressful. And I wonder if my body would have healed up and if I would have had the same expedited recovery process if I would have been at work. Yeah, I will probably try to have an update in a couple weeks.